Hi, I'm Dr. Reza Jarahi. I'm one of the co-directors of the UCLA Face Transplant Program, and we just want to present to you a very simple and straightforward way to make a measurement of a patient's face so that we can, as accurately as possible, match up the dimensions of the donor face to the recipient face. The principle here is to get an idea of the vertical height and the horizontal width of the face. And I'll show you what we want to do, and we'll have a live patient to demonstrate on. But if look at the skull, we're interested in a couple of measurements. One is the vertical height of the face, and we'll take three measurements. One is the measurement of the forehead from the hairline to the bridge of the nose, one from the bridge of the nose to the bottom of the nose, and one from the bottom of the nose to the chin point. And those three measurements will give us the thirds of the facial thirds and their height. And then the other two measurements we'll take are what we call the inner canthal distance, the distance between the corners of the eyes, and then the inner orbital distance, the distance between the outer rims of the eyes. And I'll show you right now how to do that very simply. So first we're going to measure the facial thirds in terms of height. And if we just look at the hairline here and take a spot halfway between the brows at the bridge of the nose here, and take a spot right under the nose here, and then the chin point. And then we take our caliper, we can measure those distances, and those are what we want to record. We'll record this as upper facial third, like so, and you measure the distance on your caliper, which in this case is 67 millimeters. And then the middle facial third is a distance between the bridge of the nose and the base of the nose. In this case it's 60 millimeters. And then the lower facial third is a distance between the base of the nose and the chin point here, which in this case is 65 millimeters. So upper facial third, middle facial third, lower facial third. And then to get an idea about the facial width, we're going to take two measurements. One is the inner orbital distance, and so we can measure that by going to the lateral orbital rim here, or the bone on the outside of the eye socket at the level of the outer lateral canthus. Put a little dot there just to mark where the bone is. Same thing here, you feel for the bone. And you don't need to put these dots in practice. You can just feel with the calipers where the bone is. And the same thing here, the middle canthus or the medial canthus. And if we take our caliper, we can, so this we'll call the inner orbital distance, and I'm putting the blades of the caliper right down on the bone here. We want the bony length, and so in this case we're 99 millimeters. And then the same thing for the inner length, and we'll go right down on the bone where the medial canthi attach, and that's 21 millimeters there. And that's it. So we have our inner canthal distance and our inner orbital distance. And these are bony landmarks, not soft tissue, so we're pushing down on the bone to feel the bony distance. So by measuring the facial height, breaking it up in thirds, by measuring the facial width, by measuring the inner canthal distance and the inner orbital distance, we can get a pretty good rough estimate if those facial dimensions will match, those facial dimensions of the donor will match up with the similar facial dimensions of the recipient. And that gives us a good head start in surgical planning for the transplant.